Thanks very much for joining the call. As you probably know from what's been going around, we've tied in the Health and Safety Week with the European Health and Safety Week, and we just want to run through a few things throughout the week, just short presentations. So today we just want to do a little bit about drugs and alcohol awareness. We are recording this, so it will be able to be picked up by anybody who wants to see it at a later date. If there's anything that you missed, there'll be some bits and pieces on there you can catch up on. On Tuesday, Nikki will be doing a presentation on the SHET training, so working around SIPOL, report it, how to put stuff on, improve it. So that'll be a bit of a live walkthrough on how we're doing stuff on there. Wednesday is a little bit different. We're looking for people to go out and do inspections around projects, offices, etc. And what we will be looking for is the top 3 improve-its that come in for that week. So anything that's labelled in that week will be picked out, and the top 3 will have an appropriate prize set up for those. Thursday, again, we'll be looking at health and wellbeing providers, looking at what our employee assistance programme can offer the whole of our employees. And on Friday will be innovations. So Dom will be coming on and going through any health and safety innovations that people have put forward, what we've found or looked up. So that's just a taste of what's going on for the rest of the week. So, as I said, welcome today to a drugs and alcohol awareness presentation. So if we start with the alcohol, this is a little advert from DrinkAware of how many units are in any particular drink, so you can actually see what that is. And so we don't go too much into that. There's a small video.
This is 1 unit of alcohol. It's small, only 10 millilitres to be precise, but 10 millilitres of pure alcohol. Because alcoholic drinks come in many colours, flavours, shapes and sizes, units are a clever way to help you know just how strong your drink is. For example, whether you're relaxing at home or out and about, an average strength pint of lager has 2 units in it, while a single measure of spirits is 1 unit. And wine? Well, that all depends on whether your glass is small, medium or large. Now, if you're an average adult and you have a drink with 1 unit of alcohol in it, it'll take your body about an hour to process it until there's no alcohol left in your bloodstream. Of course, we're not all average, so that length of time could differ depending on your height, weight and gender. Also, the more units you consume, the longer it takes for your body to process the alcohol. It's easy to find an excuse to have a drink or 2, but there are lots of reasons to cut down on your drinking. First of all, you'll sleep better, which means you'll feel at your best. Secondly, you'll be looking good, as dropping the number of drinks means a drop in calories and weight. Third, and most important, over the longer term, regularly drinking too much puts you at greater risk of developing health harms like cancer and liver disease. So it's a good idea not to regularly exceed the government's unit guidelines of 14 units a week for both men and women, and spread them evenly over 3 days or more. So that's what a unit of alcohol is. To find out more, including personalised tips and feedback about healthy, helpful ways to cut down on your drinking, visit drinkaware.co.uk for the facts.
So we'll make that short video available as well on KNet, but you'll be able to pick it up off the presentation when it gets pushed out there. And there's just a little calculator on there of how it works. So units equals volumes, which is millilitres, times the content of alcohol divided by 1,000. So looking at a can of or a bottle of Pilsner that's 330 ml with 5% alcohol by volume in it. It's the units 330 ml times by 5 divided by 1,000 give me 1.65 units. So that's about an hour and a half for somebody that's average to burn that off. But you need to take into account that it needs an hour to start absorbing into your system, and everybody is different. So what this should do, a couple of hours that should have burnt through to get you towards zero alcohol in your system. And again, it all depends how much you've drank. And the same goes for the bottle of wine that's on there. The same calculation that it's done for a glass, 375 ml by 12% divided by 1,000 gives you 4.5 units. So it's a simple way of doing it, and again, it's available from this. That's all I wanted to touch on really on the alcohol part of this. But substances and these new psychoactive substances, legal highs, probably better known as, similar effects to cannabis, cocaine, ecstasy, etc. There's always possibility of accidental overdose due to the unknown strengths of substances put in these. So again, anybody who's heard me talk about people mixing drugs when we've done our road shows previously, people are unscrupulous when they're putting this together. They put anything into it to make it go further, and a lot of this stuff that goes into these so-called legal highs is not for human consumption. It hasn't been tested and gone through a lab for human consumption. A lot of it's directed at animals, so it isn't tested properly. You don't know what you're getting. Same risks as illegal drugs, so withdrawal symptoms, anxiety, can cause mental issues on some of it as well. And the big thing, I suppose, for anybody is impairment. So you have an impairment value similar to what you have with illegal drugs of cannabis, cocaine, etc. Just a few facts on it. I don't want to bore you with facts on this, but this is around adult usage of any drugs. So 16 to 59-year-olds, you're looking about 8.4%. If you take that down to 16 to 24-year-olds, that goes to sort of 1 in 5, about 18% of young adults taking illicit drugs in the last year. So about 1.1 million people. This should come to no surprise, I don't think, to anybody that's selected drugs of use. Cannabis up on the top there, followed by cocaine, a fair way back, and ecstasy, amphetamines, hallucinogens in there. Doesn't show any of the illegal highs in here. This is from the UK government, so it's just measuring what the selected drug use is. This one I think is a bit of a worry, as I've said before. Prevalence of drug use among 11 to 15-year-olds, quite high in there. And the prevalence by age is quite scary. So as it goes even down to 11-year-olds, you can see how quickly it rises up as to 14 and 15 that have taken drugs in the past year. In the last month is really high. So looking about 11%, 12%. So these are kids out and about on the street that will eventually come into the workplace.
From the 2nd of March 2015, there will be a new drug driving law in England and Wales. The new law sets limits at very low levels for 8 illegal drugs, such as cannabis and cocaine, to tackle illegal drug use and driving. The law also includes 8 medicines that are sometimes abused, with higher limits to reflect their use as medicines. If you are taking your medicine as directed and your driving is not impaired, then you are not breaking the law. It will remain an offence to drive while your ability is impaired by drugs, and if in doubt, you should not drive. To find out more, ask your doctor or a pharmacist.
So again, just a short video on that. So according to the UK Addiction Treatment Centres, opiates prescribed for pain can be very addictive. So codeines, diazepams, benzos, tramadol, all causing problems. So people are getting addicted to these over the prescribed drugs that are out there. So they're a bit of an issue in the workplace, that if you're driving and when you look down at both diazepam and tramadol, I've unfortunately had to take with a bad back, and I couldn't drive at all. My doctor advised it, but after I'd taken the diazepam and tramadol together, that was just completely out of the world. I was nowhere that I could have walked around, never mind driven around. But you need to be very careful about what it is, because some of these medicines also get picked up for driving, so for illegal drug driving now. So you have to speak, or you should speak to your doctor whether you can or can't drive with these, so you don't fall foul of the law. A little thing about how MWH treatment's performance in the drug and alcohol testing. In 2016, we did 181 tests. We had 12 positives and 1 refused and walked away. So we had 93.5% of our employees and contractors tested were drug and alcohol free. So that's quite good in the construction industry. I would have expected over 10% to be picked up and be positive. In 2017 up to date, we've done 91 tests. We've had 7 positives. So again, we've got 92.5% of our employees and contractors drug and alcohol free. And unusually, one of the positives this year has been for alcohol, and that's the first one since we've been doing drug and alcohol testing that we've actually picked up with alcohol in the system. So it was quite unusual. That it's not something that that normally happens. So it is a bit of a strange one, that, but we are getting towards winter now and coming up towards, dare I say, towards a festive season. So it's something to keep an eye out at party times, how many units you're consuming. The last one I just want you to have a look at is a drug and alcohol test at the road, or drug test at the road.
On the 2nd of March this year, the legislation was changed to involve a new offence under Section 5A of the Road Traffic Act 1988, which is driving whilst over the prescribed limit through a specified drug. There's 17 drugs, 8 illicit and 9 prescribed. So you can now be OPL through a drug. So this is a roadside screening device for detecting cannabis or cocaine in a person's system. It's called a drug wipe. It's very simple to use. All we need to do is take this sampler off and swab someone's tongue for 5 seconds. The saliva is then absorbed by the tabs on the swab, placed in the sampler. The vial is cracked to mix the chemicals that analyse for the drugs. After about 8 minutes, a result comes back, whether it's positive or negative. If it's positive for cannabis or cocaine, the person is arrested. The blood's analysed, and if they come back over the prescribed limit, they face a 12-month ban or a prison sentence and a hefty fine.
So there's a few short videos there you may want to review and look at. It was interesting that on that drug test on the side of the road, it was cocaine and cannabis they were picking up on. But if the police pull you over and think you're impaired, regardless, they can take you in if it isn't cannabis and cocaine and get tests done in the police station if you have reasonable doubt about what you've taken. And that's where, if you've taken over-the-counter or prescribed medication, that you could fall foul of that. So if you want to open the mics up, if you want to ask any questions, if you'd like me to go back to a couple of the slides that I didn't talk over because I forgot to open the microphone up, I'm quite happy to do that as well. So if there's any questions at all. Okay guys, if there is nothing, you can phone me later on if you'd like to discuss anything with us. But I just wanted to give you a short whistle-stop tour of the drugs and alcohol awareness. Obviously the road shows we did were quite a bit longer than this and went into a bit more detail. And we have been speaking HR and the Health and Safety Department about running some more road shows. So if you'd be interested in that with the new staff or even refreshers on it, please let HR or part of the check team know and we can sort something out. Okay, well thanks very much for listening and we'll catch you again tomorrow.